Welcome back to our fourth episode of Franciscan Knows. COVID cases continue to rise. We appreciate the value of our hospitals and the efforts of our frontliners as they continue to dedicate themselves in taking care of us. And in our part, we should also value our well-being. And that is what we are going to showcase in this episode.
The Franciscan contributions on health and well-being of the Filipino people with regards to building hospitals.
The early Franciscan missionaries did not waste any single of their time here in our country. They were indeed full of zeal and are innovative and courageous enough to build these things for the benefit of our well-being.
Let us just take, for example, the many hospitals the Franciscans built before, and most of them are still existing today. Given the threats of this pandemic, we really need hospitals today to cater people who are infected with the virus and other life-threatening diseases.
San Juan de Jos Hospital, that is located now at Rojas Boulevard, was the oldest existing hospital in the Philippines. It was built on 1580.
Fray Juan Clemente, a lay brother who was one of the pioneers in building the hospitals. Despite of his difficulty in learning the language of the natives, he devotedly studied the medicinal value of tropical plants in curing diseases of the sick and poor. Imagine the richness of our country with these tropical plants, plus the dedication of these friars to improve the well-being of the Filipino people.
Hospital of the Holy Spirit in Cavite was built on 1591. It was intended for the sailors and the laborers of the arsenal there, which was highlighted in our previous video.
San Lazaro Hospital was the first leprosarium in the Far East. It was founded first as a dispensary in Intramuros by Fray Juan Clemente in 1577. In 1578, it became a full-blown hospital.
Hospital of Agua Santas in Los Baños, Laguna was built on 1592 through the initiative of San Pedro Bautista. He discovered the therapeutic benefits of the thermal springs on the site, which led him to open a hospital. Now, people flock the hot springs for leisure and relaxation.
That's why, in 1608, convinced of its therapeutic value, rich natives donated land for the expansion of the hospital. With the generosity of the natives and the collaborative efforts of the religious and the government, the Holy Waters Hospital has gained a reputation for itself.
Wow! It's like hitting two birds with one stone. We have one hospital and a hot spring at the same time. That's the Franciscan spirit.
Grabe talaga! This is again a challenge for us Franciscans of today to value the holistic well-being of the people.
Just imagine, if not for these hospitals, saan pupunta yung mga mahihirap at may mga sakit? Thanks to these contributions, we are now enjoying the benefits of all the hard works of the pioneer Franciscans, not only in taking care of the spirit, but also the body.
As Franciscans, we make use of our resources for the benefits of this franchise in the fringes of our Christian communities.
In short, yung mga nasa laylayan ng lipunan.
That's why we owe much to the early Franciscan missionaries who came to our country, who have developed and built these structures.
Now you know!
Franciscan knows.